Irritable bowel syndrome, or IBS, is a disorder of gut-brain interaction that is diagnosed based off of someone's symptoms, and then it's put into different subtypes based off of someone's primary bowel habit, whether that be diarrhea, constipation, a mixture of both, etc. So today we're going to be talking about the 4 different IBS subtypes and also what distinguishes one IBS subtype from the next. And so the 4 subtypes we're going to be discussing today include IBS-D, which is IBS with diarrhea, IBS-C, which is IBS with constipation, IBS-M, which is IBS with mixed bowel habits, and then finally IBS-U, which is IBS with unclassified bowel habits. So something I want to point out is that while the main distinguishing factor between a lot of these different subtypes comes down to the differences in bowel habits, there are a lot of different overlapping symptoms like abdominal pain, bloating, distension, etc., that can be experienced by all of the different subtypes. And if you're curious to learn more about different IBS symptoms, we've done a video that's dedicated specifically to that. But for the sake of this video, we're mostly going to be focusing on things like the differences in prevalence of the different subtypes in the population. And we're also going to be talking about the differences in symptom criteria that have to be met to be diagnosed with each of these different subtypes. So first things first, we're going to talk about the prevalence of these different IBS subtypes within the IBS population. So when it comes to the most common IBS subtypes, hands down, those are going to be IBS-D, IBS-C, and IBS-M, and IBS-U is a little bit less common. Now, the prevalence as far as like percentage of people who have IBS that, have IBS-D or IBS-C, those numbers can vary a little bit, and there's often a range, and that is related to things like changing IBS symptom criteria over the years. So that being said, for IBS-D, the prevalence within IBS is about 27.8 to 31.5% of IBS cases. For IBS-C, it's about 20% to 29.3% of cases. For IBS-M, the prevalence is 33.8% to 26.4% of cases. And then for IBS-U, it's around 14.1% to 11.9%.
Before we continue, I want to quickly tell you about IBSprobiotics.org. So this started out as a research project, but then we ended up turning it into this really cool comparison tool. When you go on the site, you can easily compare which probiotics were most effective for different IBS symptoms, all exclusively based off of clinical studies. In fact, we spent the past 2 years building it, having analyzed over 50 different probiotics across more than 75 placebo-controlled trials. And the results surprised us. For example, we found that some really popular probiotics were nowhere near as effective as some lesser-known options, and there were even some probiotics that seemed to do more harm than good. So I hope this free tool helps you to cut through the marketing hype and saves you a ton of time when evaluating a probiotic.
So what are the criteria for being subtyped with each of these different IBS subtypes? So first things first, in order to be subtyped with IBS, you first have to have an IBS diagnosis. And to have an IBS diagnosis, you have to meet certain symptom criteria called the Rome 4 criteria, which come to us from an organization called the Rome Foundation. And the Rome 4 diagnostic criteria for IBS stipulates that you have to have recurrent abdominal pain, on average at least 1 day per week in the last 3 months, associated with 2 or more of the following criteria: related to defecation, associated with a change in stool frequency, associated with a change in stool form or appearance. And these criteria have to be fulfilled for the last 3 months, with symptom onset at least 6 months prior to diagnosis. So basically, an IBS diagnosis comes down to there being 2 core symptom features, including having abdominal pain and also some form of an altered bowel habit experience. But when it comes to subtyping, that is determined based on the primary bowel habit that is experienced on days with abnormal bowel movements. So how do you know what's a normal bowel movement as opposed to an abnormal bowel movement? Really, that comes down to stool form more so than frequency. And what we use to assess stool form is this tool called the Bristol Stool Form Scale, which basically shows 7 different pictures of 7 different types of stools, with types 1 and 2 being indicative of constipation, types 3, 4, and 5 being indicative of normal stools, and types 6 and 7 being indicative of diarrhea. So I'm briefly going to go over the different Rome 4 criteria for each of the subtypes so you can see the differences in primary bowel habits that are experienced from one IBS subtype to the next. Now, again, subtyping is based off of days where someone has experienced an abnormal bowel movement. So for IBS-D, you have to have greater than a quarter or 25% of bowel movements with a Bristol stool form scale type 6 or 7 on days with abnormal bowel movements, and then less than a quarter or less than 25% of bowel movements being a Bristol stool form scale types 1 or 2. And then in clinical practice, a patient report of someone primarily experiencing diarrhea or a type 6 or 7 stool form on the Bristol stool form scale may alternatively be used by your medical provider to diagnose you with IBS-D. Now for IBS-C, it's kind of the reverse. So for this subtype, you have to have greater than a quarter or 25% of bowel movements that are a Bristol stool form types 1 or 2. And you also have to have less than a quarter or less than 25% of bowel movements that are a Bristol stool form type 6 or 7. And of course, this is all on days with abnormal bowel movements. But again, in clinical practice, you may simply just tell your physician that you frequently experience constipation or Bristol stool form scale stools of a 1 or 2. And that can alternatively be used to diagnose you with IBS-C. Now, for IBS-M, people with mixed bowel habits, these are the folks that kind of have the worst of both worlds, both constipation and diarrhea. So the criteria to be diagnosed with IBS-M would be that you have to have greater than a quarter or 25% of bowel movements with a Bristol stool form scale of types 1 or 2 on days with abnormal bowel movements, and also greater than a quarter or 25% of bowel movements being Bristol stool forms type 6 or 7 indicative of diarrhea. But alternatively, in clinical practice, a patient could report experiencing both diarrhea and constipation, and this might be used instead by your practitioner to diagnose you with IBS-M. Now, for people with IBS-U, this one's a little bit trickier to describe as far as subtyping goes because these folks meet the base IBS symptom criteria, but their stool patterns cannot be accurately ascribed to one of the other subtypes. So they kind of have their own subtype. But one of the alternative things that can be used to diagnose someone with IBS-U would be that they meet those core diagnostic criteria, but they also report that they rarely experience abnormal bowel movements like diarrhea or constipation. Now, when it comes to getting the most accurate subtyping diagnosis possible, there are some different things that you can do to aid that process. For one, I would strongly suggest keeping a stool form diary for at least 2 weeks, and also potentially keeping a diet diary. That way you have a log of the foods that you're eating that may be provoking different symptoms. It's also a really good idea to not be taking any medications or supplements that could potentially alter your bowel habits or your bowel frequency, as that may alter the subtyping diagnosis that your medical provider arrives at. But long story short here, all of the different IBS subtypes have several symptoms that can overlap, except for those bowel habit differences, which are used for subtyping, with people with IBS-D experiencing more frequent bouts of diarrhea, people with IBS-C having more frequent constipation, people with IBS-M having a mix of both diarrhea and constipation, and people with IBS-U meeting the base criteria for an IBS diagnosis, but not having bowel habits that can fit neatly into any of those other categories. And that's all we're going to be covering today about the differences between different IBS subtypes. But if you have any questions for us about this video or about the different IBS subtypes, please feel free to leave a comment in the comment section below. We would love to hear from you.
Thanks for watching this video. And as a quick reminder, don't forget to check out IBSprobiotics.org. We're really proud of this research project turned comparison tool that we've made. And of course, it is free and publicly available. And if you want to keep up to date with the latest IBS research, you can follow me here. See you next time.